All right, everyone, we are back, and we're going to finish up our podcast today with talking about our final thoughts. A funny quick story here. So, in the chiropractic world, all right, there was the guy who basically founded chiropractic. He had a son, and his name was B.J. Palmer, and he always talked about thoughts. Now I'm sure there's a story, and I'll have to research, but I don't really know why. But he always abbreviated thoughts without the O or without the UGH, so it was THOTS. Well. As the Urban Dictionary will be quick to tell you, there's a little bit different meaning these days to thoughts without the UGH, but that is not what we're going to be referring to here.
It's a little different.
Nobody over there. Um, these are our thoughts, and they're our final thoughts of the day. And what we're going to talk about here is something specific that drives us nuts. I joke around that there's a chiropractic disease that we all get as chiropractors, and we will see somebody doing something, and it's like, cringeworthy. It's so aggravating. It's so irritating, whether it be a bad posture, a bad habit, a bad lift form.
Usually in the gym.
Oh man, the gym is just the worst. Sometimes I wish I had blinders on and could only see what I'm doing.
You ever see those videos on Facebook where people are just doing, like, what are you doing? And people will tag us in it and be like, what do you think here?
Yeah.
And it's like, if you look at what that machine is, that is the exact opposite of what you should be doing on there.
I get Instagram messages a lot from my good friends that are bodybuilders, and they are always sending me stuff, and they're just like, what do you think about this one? And I laugh, but I cry a little bit inside too. So this week, what we're going to talk about with our final thought is parents that don't take a responsible role in their kids' health. Okay, and I don't know. I'm not trying to pick on parents out there, because some of it's a lack of education, some of it's not. Some of it's people just not paying attention, and they'd rather have a media device babysitting their kid. But so much of what parents think healthcare is for kids these days is them not having a snotty nose or a runny nose or a cough or whatever. When we're thinking about kids, and I have kids of my own, they're older now, they're 16 and 13, but when I'm thinking about healthcare for my kids, it's very much about their wellness. What can I do to keep them healthy, not just now, but for the next 20, 30, 40 years, long after I'm gone, and also instill that knowledge so that they can share it with their kids. So I think we're going to talk a little bit about what we see that kind of drives us nuts in that world, and I think Jim's going to talk a little bit about some of the stats on nutrition with kids.
Just to clarify, I don't think this segment's always going to be what drives us nuts. Today
it's what
this was a good start, because common things we see every day, in the office, out of the office. So, it's one of those things too, where when we start talking about nutrition, I've got families who come in, and one of my locations inside of a yoga studio. So the yoga studio always has little chocolates or little candies out front, and the kids just run right over and they're like, Dr. Jim, can I have a piece of candy? And I'm like, you can have whatever you want, but make sure your parents are cool with it, And then usually the parents they'll play a game, and when the kids get adjusted and they do, good that day and they're behaving themselves, then they can have a piece of chocolate. So if kid 1, 2, and then 3 get adjusted, and now it's time for mom's adjustment, the kids are usually in the other room, taking down 1, 2, 3 pieces of candy. And then little by little, you start to see and hear and feel the ground shaking, and the kids running around, and you hear things, falling off the bookshelves or whatever. And what I'm trying to get at is sometimes it's what we're putting in our bodies, and we wonder why the kids react the way that they do, or maybe they give the parents attitude. You see that coming through, and there's a disconnect between what is good for that kid, or just get out of my way. And sometimes I don't want to say the parents are pushing them away, but it seems like, okay, this is my time, go over there. And whether that's a piece of candy, or here, take my phone, go listen, watch a video, here's my iPad, leave me alone. And it's like, where did we go wrong? And I know my part of this is talking about the nutrition, but there's always options when it comes to giving your kid, something to either increase their health or take them further away from health. And a lot of it starts with, the increase of sugar. And unfortunately, there's a lack of knowledge when it comes to what happens when certain things go into our mouths as far as nutritionally. So sugar is an easy one, and most people out there who understand a little bit about the world of nutrition, when sugar enters the body, it allows for the body to store everything, including fat. So fat cells that are there, you may not see it in your kids yet, but the fat, once we gain fat cells, they never go away. And if you gain them as a kid, they're a lot harder to lose as we get older. Okay, I used to be 235 pounds. That was the most I'd ever weighed. This morning I weighed 189. So there's a huge amount that I didn't know back in the day. When I used to lift, I think I'd go to Chipotle 2 or 3 times a day, run through drive. I was trying to get as much calories as I can, but it was in my teens that I gained a lot of weight that was unwanted. And maybe I didn't understand it back then, but now I can appreciate, what that does. If you gave me some candy, I'd probably be sitting on the couch or just eyes closed and be, done with this whole podcast. But so bringing it back to what we can see here, the percentage of children and adolescents, and I think it was between the ages of 6 and 19, the amount of obesity has more than tripled since the 1970s. And recent data from 2015, 2016 show that nearly 1 in 5 school-age children and young people, so this is ages 6 to 19 years, in the United States has obesity. That's incredible.
It's actually very unfortunate. So we're setting our kids up for failure. And again, I'm not trying to pick on parents who have kids that are obese, but at a certain point, we all take responsibility for ourselves as adults. But when we're kids, we're relying on our parents to help us out. And
we're at the mercy of what they give us.
Exactly. Yeah. So, when you're making these decisions, and sometimes they're out of convenience, and, look, man, like I said, I have 2 kids. You think my kids have eaten candy? Yup, they sure have. But I make sure that they know what's healthy, and I limit that stuff. So I'm divorced. My kids probably sometimes hate coming to the house because I have more healthy food in the house maybe than their moms or something. But I just don't keep it here. I don't keep a lot of junk here because to be quite honest, it's because if it's here, sometimes I'm going to be snacking on it, and I don't want it. I don't want it. So right. I will make sure that I don't have a lot of that in the house. But I have, even if they're not perfect, and look, nobody's expecting perfection. Everything's in moderation. But we have to be able to say, all right, enough is enough, and not let things get out of control, because that's our job as parents. That is our job going forward. And if we want to protect the future of the country and stuff, we're talking about, we have a massive healthcare crisis, okay? And if we talk about the number one cause of preventable disease, it's now obesity. It's not smoking anymore. That's number 2. We'll get on that topic another time. I'm real passionate about that one, but that's not for today. But the number one leading cause of illness that's preventable is obesity.
Diabetes, heart disease. Yeah.
It all falls in line.
Yep. And then, on top of that too, if you don't know, ask. And there's so much information out there. And what we do, this is kind of cool too, those show studies. What we do right now, what me and you are doing, sets up for our, is it 4 or 5 generations from now at a cellular level. So, what you're giving your kids is going to affect their kids. You know what I mean? So it goes on and on. 5 generations is, I think, what they're showing.
Yeah,
so
because we're changing our genetics constantly. We're changing we're changing what we do. So, me working out before I had kids, I changed my genetics. So my genetics aren't the same as my parents were. So I've gotten them a little bit better. And now my son, he's building muscle faster than I ever could at 16.
It's impressive. Yeah.
So it's kind of cool. So next topic with kids is going to be something we alluded to before with the postural stuff. So backpacks. Backpacks, there are actually 2,000 per year emergency room visits from backpack-related injuries, and that's outstanding. That's horrible. Again, super preventable, and I always check my kids' backpacks. And side note, this is sick and disturbing. My kids both have bulletproof backpacks.
Oh,
yeah. I mean,
that's another topic for another day.
Another topic for another day. But they're in their bulletproof backpacks. I have to check the weight, and I have to tell them, hey, listen, if this isn't necessary to carry, get it out of there. Because 55% of kids carry loads greater than 10% of their body weight. And that's from a study. And 85% of children have had discomfort and pain due to backpack use, and that was for college students. And then finally, 80% people had less pain and body strain when they changed how they loaded or wore their backpacks, and that was with middle schoolers. So there's a lot of studies out there. There are ergonomic backpacks. Look, no kids want to be dragging around the little wheelie cart. I get it. But we can change the load. We can look. There's a couple of cool companies out there. Airpack, I think, is one of them. That they do one, and they change the load. And if the more you can distribute it across the different parts of the body, maybe out to the side or whatever. Definitely not all on one side. And if it does have straps, you got to put both straps on. Got to put over both shoulders so you can have that equal distribution of weight. But this is on the parents to check this, and I hate to say it, a little bit on the teachers that they got to realize.
Where does the awareness come in? The teachers should. I take care of a lot of teachers too, and I don't know that it's on their radar. They don't feel it's their responsibility, but it could be something that at the highest level of the public school system, they could throw it in over the summer as something that they can start to look out for, because they're in communication with the kids and the parents at such a young age. Start these habits early, and it can even come back to mom. I know we're talking about kids right now, but how many moms do you see out there? You have to check let me see that purse. Is there a cinder block in here? They carry everything in there, and usually it's one-sided straps that start to tilt the spine. For those of you on video, you can kind of get the visual there. But it's just lighten the load, bring what you need, and then try to vary the load. If you have a crossbody strap, I'm not going to say throw it away, but if you're going to maybe Monday, Wednesday, Friday, you wear it across one shoulder and then you flip it the other way, or going into school it's one shoulder, going out of school it's the other. Just some ideas.
Like I said before, you and I, we're very realistic. We're not ever expecting perfection, but what we're going to do is we're going to try to give tips that are going to be real, that are things that we're not just in a clinical lab here, and I know that we're not going to have stack something up on one shoulder and then on the other, and then have stuff in our cargo pants that nobody wears anymore. We're going to give real life tips on this stuff, and we're sympathetic to those things with our patients. We're also going to be that same way with you guys. And then finally, and this is the one,
the big one.
So, the mobile devices. Okay, so we've got the cell phones, and we've got the iPads, and we've got the videos. And the studies right now, and this is from 2017. I swear these are outdated, massively outdated. Kids under 8 look at mobile screens for an average of 48 minutes per day. According to a study from Common Sense Media, that's more than triple the average recorded 4 years earlier.
I gotta believe that number's higher.
I guarantee you. I'm sure that Apple, with their new screen time thing, if they're monitoring this, maybe they won't release it but it's gonna be scary, because these kids are looking at these screens constantly.
And that goes back to the posture stuff we covered earlier in the show.
Exactly. And then on top of that, we've got TV time, and we want the kids to study, but they're also sitting there, and a lot of times they're using their mobile devices or their computers to study. Mm-hmm. So we have way too much head flexion, neck flexion, where all that's sitting there. I'll see kids in the waiting room of my office, and they're sitting there waiting for their parents or whatever, and the parents sitting there with neck pain, and I'm sitting there thinking, wow, why don't you look next to you at your own child and think, hey, he might be setting himself up for failure in the future with his posture.
Exactly.
Or her posture, or whatever. So the American Academy of Pediatrics recommends that no more than 1 hour per day of high-quality programs for children 2 to 5, and consistent limits for kids 6 and older. And I think that I'm not really going to just tie that into TV. I really want to tie this into posture stuff specifically, because those stats that you gave earlier regarding the head and neck flexion, that is a huge thing. I've got kids, and they're sitting down and they're slumping. They're basically sitting on their middle back by the time they're sitting there. Their head's in full flexion, and they've got the phone or whatever. Sometimes they got headphones on. They're in a disconnect. They're off in la la land. But we have to take responsibility as parents to put a stop to that. Sure. and say, hey, listen, sit up, pay attention, be aware of what's going on. And if you do, look, we're all going to use it. My kids have phones. bring that phone up to your face and use a downward glance as opposed to flexing that head all the way down to the phone that's sitting in your lap. I always say phone to face, not face to phone.
Like it. It's easy to remember.
Yep. So.
And sometimes too, you can even flash a quick picture to the kid, like, this is what your kid was doing. Like, you know what I mean? If the patient's face down on the table and you look across the hall and you see the kid sitting there, actually with like us, headphones on, and they're just like totally hollowed back, quick picture and be like, she sat like that for 15 minutes while you were, back here getting your work done. So
I feel bad sneaking pictures, but I've done it.
You can delete them.
Yeah,
but
I want to delete them, of course.
It's the awareness, because sometimes they have no. And parent, look at you and me going in to get someone. Let's say you came in to get work done, or I come in to see you. I'm there to get better. So whoever comes with me, my dogs, I don't have kids yet. I'm not worried about them. I want to try to get fixed. So I'm not being rude on purpose to them, but it's just I'm not thinking of it's on my radar. But the other thing too is, we're not trying to be an enabler, but we are. And this can go in multiple directions, but you have the ability to not give your kid that. I know they might throw a fit, but you install those habits, so sometimes you have to kind of recreate new ones.
Yeah. So it's something to be aware of. As many of you guys that are going to be watching this, listening to this, you maybe either have kids or maybe grandkids, or maybe you're going to have kids or whatever. Or even if it's for yourself, these things, they apply to college guys and girls who are carrying their backpacks and sitting there with their phones. So we want to teach you guys and give you as much information as you can possibly have. So. And really, that's about all we got for this week, man. I think
we covered a lot, though.
Yeah, we did.
That was fun.
It was fun. We have a lot of interesting material to come. We've got some cool people lined up to do some interviews with. I'm going to save all those for nice surprises for you guys. If somebody's out there is watching and you're an expert in a field or an athlete or something, and you want to come and be on with us, so we can get you on mobily, give us a ring.
Yeah, we'd love to have you, and hopefully, if you guys get a chance to see the YouTube video, or if we end up bringing this to Facebook and the other levels, we're going to do a segment before each show that includes a chiropractic adjustment. So you get a chance to see behind the scenes of what an adjustment looks like, typically a full body or whatever the person might need. And then as our guests come on, we may have to include that for them too, so they can feel fresh for the show.
Exactly. So guys, please check out all of our social media pages. We have a Facebook, we have an Instagram, we have a Twitter. I don't use Twitter as much as I probably should. I know you're a better Twitter.
It'll be there for quick look. It just depends what the person. I mean, Instagram's so visual, so that's going to be a big one for us. But Twitter's a quick little click, link over to probably YouTube and the other channels.
Right, but please follow us. Everything's going to be optimal function. Just like it sounds, and the FNXN, like in our podcast here. So follow us there and check us out. We look forward to next week when we're got some more topics to cover, and maybe even have an interview. I think we will have an interview next week. So that's it for now, guys. You guys have a wonderful rest of your week.
See you guys. Have a great one.